Chinese researchers have discovered a new bat coronavirus that uses the same pathway as COVID-19 virus to enter human cells. Lab tests revealed that the virus can infect human cells and artificially grown lung and intestine tissues. The virus, however, does not enter human cells as easily as the COVID-19 virus and has limitations that make human transmission less likely, despite concerns about another pandemic. Experts say the risk is lower due to existing immunity to similar viruses.
All right, to talk more about this, we have Dr. Tony Leachon joining us today via phone. All right, good morning, Doc. Thanks for joining us.
Good morning. Good morning to your listeners. This is Dr. Tony Leachon.
It's Angela and Angelo po.
Yeah, good morning, Angela and Angelo.
Yes, Doc, let's get right to it. Now, can you tell us more about this, yung nasa news namin, about this new bat virus?
Yes, well, the new bat virus, they call it HKU-CoV2. Scientists have found that this can bind to the same receptors, just like the COVID virus. Now, this newly discovered coronavirus, the HKU5, similar to the virus that caused the COVID-19, has been identified again in China. And the discovery was made by a team of virologists named Xin Shengli, known as the Batwoman, for the extensive research at the Wuhan Institute. So basically, it belongs to the same coronavirus that belongs to the COVID virus responsible for the Middle East respiratory syndrome. So scientists right now are thinking whether there's a potential for animal to human transmission. But it has a lower binding affinity to the receptors, and it poses, to me, not a serious health threat. But of course, knowing that we came from the pandemic, then we need to understand that it may actually affect us directly through the bat or intermediate hosts like humans. But definitely, based on the research, it has lower efficiency than the COVID-19 virus.
Pero Doc, para klaro lang, no, since it's medyo related daw sa yung sinasabi niyo sa COVID-19, same symptoms po ba to if tumama ito isa-isa sa isang tao?
Well, pag tumama sa tao to, it is weaker than the COVID natin. And ang pandemic threat is low. And therefore, ang symptoms lang ang kailangan bantayan natin because it might have the same similar symptoms like lagnat, ubo, shortness of breath, sore throat, fatigue. And it can spread to two possible ways. Direct transmission from the bat sa paniki. If people will come into contact with infected bats or fluids of the bat, like saliva, urine, or feces, they could get infected. Or through humans. The virus might infect another animal like humans before jumping to or animal like a mammal, then jumping to humans, and then mag-spread just like the COVID virus. So, sa ngayon, all we need to do is to inform the public, to educate, to empower them, and never be complacent about this. We must be, I would say, vigilant about all of these things so that kung dumating yun, we should also always be ready about it.
So, but either or, parang na rin, mag-ingat na rin tayo. But other than that, ano pa po yung mga steps na dapat na po nating gawin, to be able to know more about this virus?
Well, we keep on reading and then kailangan magbasa tayo sa World Health Organization or other academic institutions of science like the Harvard or the Stanford or sa CDC. But ang the best natin is sa ngayon, mag-masking pa rin tayo in crowded places and then palakasin natin ang immunity natin. Tapos magpa-flu shot tayo or pneumonia vaccine just in case dumapo sa atin, it may not be directly related, but of course, the other viruses and bacteria may also affect us.
Yeah, you're saying, Doc, na hindi naman directly related, but if you have already a previous COVID-19 vaccine, meron ka pang influenza, flu vaccine, meron ka pang pneumonia vaccine, you think that would at least somehow, if ever lang, Doc, mitigate or bawasan yung mga symptoms?
That's correct. Kasi sometimes, yung mga virus can have super infection eh. So, mas mabuti na lang na covered tayo. Ngayon, marami ng technology. Meron tayong respiratory panel to identify what kind of virus ang tatamaan ka. So far, for the public, we have an outbreak of influenza A. Yan ang common ngayon among elderly citizens. Ang daming nagkaka-influenza
yes.
A and then na-intubate. Yan ho yung mga cases natin. But it can be controlled by the usual masking and hygienic measures.
Doc, kasi ang dami, you mentioned influenza A, meron pang for a time in January, sunod-sunod po nagkakasakit sa pneumonia. And as I understand, very similar po ang mga symptoms sa mga ito. Now, how do we differentiate one sickness from the other? And when should we go to the doctor or to the hospital para magpatingin?
That's a good question. Pare-pareho kasi yung symptoms ng flu and other viruses. Pero ako, ang strategy ko, rather than gumastos for the respiratory na panel, I usually start the patient already on Tamiflu, 75 milligram twice a day for 5 days, just in case influenza A siya. And then kung may atypical infection, nag-start ako ng azithromycin. Alam mo, in no time at all, effective. And then, let the patient rest for 5 days. Magiging okay na rin siya. And I find it effective, even online, kasi wala namang opportunity for some of our countrymen to go to the labs or seek medical consultation. So, ganun ang ginagawa ko. So, and then, take precautionary measures as well.
Alright, on that note, maraming salamat po sa inyong oras. That was Dr. Tony Leachon, na health advocate. Thank you so much for joining us today.
Okay.